Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hahn. The world of technology and healthcare ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be discussing how consumer health tech will impact provider organizations. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 20 years of health IT content at healthcareittoday.com. So, Colin, how many trackers do you wear? Do you sleep with? Like, how many do you personally use?
Well, I used to use a Fitbit Charge 4 almost religiously. I mean, I wear it all the time just to track my steps and stuff because I usually try to hit that goal. And I know, a number of steps is not, it's not medically proven to do anything other than the fact that you're moving. But I do like it just to kind of track to make sure I am moving enough in the day. So I used to wear that a lot, but for holidays, I got a new one.
Oh, you got the
Yes.
smartwatch, huh?
I got a smartwatch. Yeah, so I got a new one. This one actually, funny enough, was recommended by Mr. Who's the Boss. If I don't know if you watch that YouTuber, but it's an Amaze Fit, which is just a tracker. So yeah, I'm using that now, and I do sleep with this one, so it's been pretty good.
That's interesting. Yeah, I've used a lot, and I kind of ebb and flow between what I use. I still wish that the cell phone was just a full tracker. Give me a picture every day or something. I don't know, because you have the cell phone all the time. But I definitely step on a withing scale every morning.
Ah,
That's probably my biggest tracker. My wife and I have used the Ringcon for a lot of years as well, and it has a lot of interesting data. I'm actually meeting with Aura at CES. So I'm interested to
mhm.
see how they're evolving. But I've tested a lot of others, some sleep ones, some blood pressure cuffs, a number of different scales over the years. So yeah, it's definitely interesting to see the variation. How about when it comes to direct consumer Gen AI? Have you used that for your healthcare? I know I've used it with my kids, and my wife uses it even more than I do, which is interesting. It hops on and just asks all sorts of health related questions.
I've used Gen AI. Well, I've used AI in general for health, but mostly health questions, not re necessarily related to my personal health. I've asked for like, does this react with that? Like, does ibuprofen react with this medication? So can someone take both at the same time, kind of
Yeah.
stuff, right? So it's not specific to a health condition, but it's more about medication questions or, whether or not I should be doing this after I hurt something, right? Like, what's the best way to recover from a sprain in this area? So yes, but honestly, it's probably the same thing I would have Googled before too, right? It's not something specific that I'm
Mm.
using for AI quite yet.
So you're missing out, is what.
That's basically what I'm missing out. I should be using it more, is what I'm saying. Yes.
I mean, that
But,
is the question, right? Like, what are we most excited about, right? When it
yeah.
comes to consumer health tech. And to me, the answer to that is the Gen AI responses. And I think
Okay.
the thing that I love about it is it's amazing how it can process such a vast amount of info. Like, you literally could dump your health record in, and it does a pretty incredible job of processing all that information out of context, non-standard format, and then of course it uses everything in its knowledge base and understanding from, the math that it's done on the large language model, but it's incredible how it processes it. So, I think to me that is the most exciting area. I'm not quite ready to do like Elon Musk was saying on X, Twitter, whatever it's called these days, where he's like, upload your radiology images. Although I have to admit, I just had a full body MRI and I was kind of interested. Like, what if I upload my full body MRI? What would it say? But I'm also a little nervous, right? Because of the privacy considerations and things like that.
Yeah, actually, I'm in favor of all that stuff, as long as the privacy stuff gets addressed. And I
Really get
mean,
addressed?
Well, I mean, that's a question, but it's increasingly become a non-start. It's a non-question because the alternative is I don't get healthcare, period, right? Like there's just so many people that are losing coverage, that don't have access to care, for a variety of reasons, where this is the alternative, right? And so when you're faced with that choice, privacy becomes a secondary concern. But to your point, I think there are some reasonable things you can do with it. You can ask it questions and you can upload some things that maybe aren't as private concerns, right? To get some answers that maybe you have to wait days, weeks, months to get if you're in a system where you can't get access. So yeah, I'm excited for that technology. I don't, it's funny enough, I don't really view it as consumer tech. I just see it as baked into a portal now that, soon we'll have access to AIs that are trusted and that are secure through a portal eventually. But the one that I'm most excited about is a combination. I'm actually excited about what you can do with all this data that you're grabbing from these things, like from your phone about your gait and your walking and your distance traveled and all these, whether it's your scale, your utensil, or your smartwatch. And now using AI to look at that data. Because one of the biggest problems with this was what do you do with all this stuff that you've collected? Well, now I think enough people have uploaded this stuff, and people like Google have got a record of this, where now you can actually draw some interesting conclusions. Say, based on your use, your age, your genealogy, whatever you can upload. Hey, maybe it's not 20,000 steps for you, it's 30,000, or maybe it's 10, right? Because of all this other stuff that you do. So now you can get much more personalized fitness stuff. And for me, that's the most exciting part of consumer tech that I'm looking forward to is actually getting some more personalized stuff from, these trackers.
Yeah, I was going to actually say this, something similar in that what's most exciting about the AI that's going to happen is that we actually are going to provide it better data.
Right.
And so whether it's the wearables like you talked about, like the one you're wearing, right? Or Withings has a watch, there's, Apple has a watch, they're going into healthcare, et cetera, et cetera. But also you look at the ones like Viome, which is doing like a gut biome
Right.
test with full, it was stool, urine, blood, and saliva, right? Like that is going to produce a lot more data that's going to make the AI response more informed, which I think is kind of what you were saying, right? Same with Pronuvo. They did the full body MRI, but they also did the blood tests. And so now you have all those blood tests and you have a baseline biomarker for yourself. And I know there's a lot of controversy over kind of this proactive testing and whatnot, but I think the AI is going to help inform us about what really matters and what not, and it's going to, like you said, be personalized to me. So I think that's what's so cool about where AI is headed is it's not some generic response on Google based on some study from Mayo Clinic that I'm trying to extrapolate to apply to me. The next generation of Gen AI is going to take all of that knowledge across a vast number of people, including real world data. I mean, Epic Cosmos, how fascinating is that going to be with Gen AI on top of it, right? Is that going to be part of the Epic MyChart portal? That would be pretty cool, right? If it's analyzing my data against all of Cosmos data within Epic to give me a response that's personalized to me. Is that direct to consumer? Is that consumer health tech? Well, I guess if it's through Epic My Chart, I guess that qualifies.
I think that does. I think that does. Well, and on the flip side, John, is there a tech you think that actually won't last? Like, is there a tech that's sort of, in 2026 going to be retired and we're just not going to be using them anymore?
I just argued that my chart might be the future in that engagement, but I actually think we may move beyond patient portals. I actually think
Okay.
patient portals could die. And it's just going to be some sort of interface to a Gen AI bot. And maybe it goes out and checks the portal. I don't know, but it probably becomes like a bot portal where they can just request all your information and receive all the information. There's no need for a UI. It's a bunch of XML and other sharing of data that's needed. So I actually think patient portals might die in that form because of the various different chatbots and AI solutions that are coming to the market. The other one to me that's really interesting is the concierge and direct primary care stuff. I don't think it's going to die per se, but it just doesn't scale to the problem of healthcare. And so
Hmm.
it's going to remain this niche thing, which is going to be powerful if you can afford it. That's great. You're going to have a doctor in your pocket. But for the 90% of people who can't afford it, they're going to go and get the doctor in their pocket, which is some sort of Gen AI doctor, right? That they can actually afford. And so that's going to hurt the concierge, direct medicine, direct primary care, consumer, solutions that are out there that I think is going to be interesting.
Huh. Well, for me, the consumer health tech that I don't think is going to last is those devices that are baked into utensils. You probably saw it
Mm,
last year at that CES or maybe the year before. That spoon that can measure the calories, can measure how fast you're eating or how slow you're
yeah.
eating. I'm like, that sounds very, very niche. And is it really that valuable? I'm not really sure. I don't think I've seen a study or anything that shows the very use case for that. It's
Yeah.
sort of interesting. So I don't think that one will last. I also, but I think the category of those types of tools won't last. So it's a single use it once a day type of consumer health tech. I don't think will last. And I include the one that you mentioned, those scales.
Mm.
Um, because I think eventually you can wear a patch, you can wear your watch, maybe your phone will one day do this, right? Because it can see it's in your pocket all the time. So why would I need a single once a day use device to track something when I've got something that can do it continuously? So I think over time, what we're going to see is that dying away, like those single use type of fitness trackers and health tech. I think we're just going to go to continuous.
Well, maybe if I take the GLP-1, I won't care about the scale as much. I don't know. That's interesting. The only spoon that I think could survive, I don't know if you saw the robotic spoon that
Okay,
adjusts for someone that has a
sure,
tremor. Like
sure. Those
that
ones
was
are
pretty
different.
cool and
Yeah.
that's useful. But I agree. Any of the calorie counting ones, I just don't see a path forward for those. It doesn't make sense. It doesn't actually solve a problem per se. And it's not something most people care about. So I'm with you there. The other consumer health solution that I think is gonna probably run into trouble is what I define as like the pill mills.
Hmm.
The Rose of the world, those type of direct to consumer pharmacy solutions, which we understand why they were there and why they've been successful. It's because you need a pharmacist or a doctor to prescribe the medicine to be able to get the medicine. I think that the policies are going to change in a way that that's not going to be needed. And so I don't know if that's going to be in Gen AI bot that's going to approve it and then do it. I mean, maybe they'd love that. They'd rather have that than a doctor. And so maybe those brands will survive because there is something about the distribution that they have now. What they've built over the years is a patient population that obviously wants these services. Could they just, optimize it with AI and then get rid of the doctors if policies change? Maybe, but I don't know. I'm interested to see where that space goes and how that evolves. It's definitely going to be influenced by the policies that are created though.
Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we are discussing how or if consumer health technology will impact provider organizations. John, why don't we just get to that title of the question? How or it will consumer health tech actually impact healthcare providers?
Yeah, I mean, there's little doubt it's going to impact them. It already is. They're coming saying Dr. ChatGPT, not Dr. Google. So you have that impact already to some degree. And to be fair, I've heard so many anecdotal stories. So I don't know how to measure this in a quantitative way. But the number of people who either decide to go to the doctor because they consulted AI or decide to wait to go to the doctor because they consulted AI or whatever, right? Like every sort of iteration of that because AI influenced the how they want to get care, the type of care they want, how quickly they get care, etc. Like I already think those patterns are starting to change. But I would say it's actually going to take probably 3 to 5 years for the real consumer tech revolution, which is, hey, I have an AI solution that solves my problems and I don't need to go to the doctor. Like that kind of impact on provider organizations. I still think that's 3 to 5 years away. But then I think we're going to see a major shift for provider organizations where they're still going to be needed for some really complex cases, for interventions, for surgeries, for treatments for certain things because the laws aren't going to catch up with all the cancer treatments or other things like that, right? But I think for a lot of the care that especially that 15 to 20% of care that doctors probably don't want to provide anyways, although it does provide them a little break in their day. That's going to be a problem we're going to have to address, right? If all you have is these intense cases all throughout the day, can you do 15 a day? Whereas before you'd have 5 to 10 hard cases and 5 to 10 easier ones to give you a break, right? And so anyway, I think that, but 3 to 5 years from now, I think we'll be there where we're not going to the doctor for a cough and cold anymore. Instead, I think we're going to be going to AI or some online consumer tech solution to get us that. But when I break my arm, I'm going to go and have the ortho put it back together.
Yeah, I mean, it's hard for me. It's hard to say. Like, we've had fitness trackers for years now, right? And are we healthier or are we the same as before? I would argue it's not clear. Meaning, I don't think it's had a huge positive impact, nor has it had a negative impact. I don't think people are
Yeah,
delaying care because of what your Fitbit told you, right? Or
I
your
don't think
tracker
it's gone
told you.
either way. Yeah.
Right. So it's interesting. So are we making better choices? I think individually, some people may say that it has helped them make better life choices, diet choices, exercise choices, and I think that's good. And I think that is how localized the improvement is. But for the industry as a whole, and our industry as a whole, as healthcare, I'm not really sure consumer tech has reached the point where it's going to have a major impact on how healthcare operates or how healthy or not healthy patients are going to start showing up yet. I think we're getting there, and I think AI is going to have a bigger impact than the consumer tech. And to your point, fulfillment, triaging, those kinds of things will be changing over the next few years, I think. But it's not related to anything other than more sophisticated AI, as opposed to, oh, everyone's wearing one of these things or everyone's using this type of tool. So yeah, I don't really see it impacting, except in the one area of to your point, maybe the hospital stays are a little bit shorter because you can monitor someone at home. But I don't view that as consumer tech. That's more remote patient monitoring type stuff. Or maybe you can send all the educational material through some app or something, right? Like that kind of consumer level tech may help you a little bit, but I don't really see it doing anything more than it's done over the last 5 years.
Yeah, I mean it's interesting to think about the evolution. I even think of like the Withings urinary tracker, right? I forget, I think it's called UScan or something like that.
Right.
Anyway, I might be mixing up their brand names, but you basically pee on it and it measures it, right? It's essentially doing a lab test in your bathroom, which is
Right.
absolutely incredible to think about. That, to your point, that is so much more clinically relevant than any sort of Fitbit tracker has ever been. And that could influence what you do. What I think is going to happen, though, when it comes to consumer tech, you're right about AI, although I might argue that every single consumer tech is going to be AI. And so, is there a difference, right? Like consumer tech is going to be AI, they're going to be synonymous. But when I look at it, I think there's going to be a little haves and have nots. And we've seen this played out in the self-driving car area. Anyone that has a Tesla that's using self-driving mode is getting a view of what self-driving is going to look like. Now, it doesn't work for you up in Canada with the snow, but in Vegas, it works great, 364 days of the year or whatever, right? Like, and it does an incredible job self-driving. But how many people know about that? Maybe 10%, 5% of people. And so that, I think the same thing is going to happen in healthcare. Like I just imagine my mom, what does she need to be able to trust AI? Because right now I can already hear her response. Oh, John, that's nice. Let's go to the doctor and see if that's right. Like even if she like I sell her on the AI is better, it's good, it's enough. You don't need to go there. She'll want to, trust but verify kind of. She trusts her son, but she wants to verify it with a doctor, which is not a bad approach, right? But I think there's going to be that evolution, right? Where as humans we have a really hard job adapting our mindset to what the data realities are, and we think human doctors are better than AI until they're not, but then we don't realize it because our internal data hasn't caught up with that.
Hmm. Yeah, I mean that's an interesting that very again very interesting. And your comment about consumer health tech and AI being sort of somewhat indistinguishable. They're not going to, you can't pull one from the other, right? They're all going to be integrated together. AI is baked into everything. So I think it will be that. But but John, I want to go back to something you talked about before, like that whole concept about an AI doctor in your pocket. I think that's what you called it. Um, how long before that, you think we're going to get there? Or are we going to get there?
It's funny because in some ways, do we already have it? You know what I mean?
Yeah,
Like
yeah.
we have our cell phone and we can ask Grok or Chat to GPT or Gemini all sorts of medical questions. The problem is our trust with that doctor isn't quite there. So that's the real core of this question: is when will we have? I don't see any future vision where this does not happen, right?
Mm,
Like to me, this is going to happen where we trust AI to ask medical questions. The only question is how long until we trust it with those questions. And my answer is it's probably 3 years until like the early adopters are using it for all their medical questions, and they're pouring all their health data into it to inform it better, and it's providing a near doctor like experience when it comes to analyzing your health. And I think what's going to happen, this kind of correlates to the previous question, which is the new AI doctor is going to be a wellness doctor.
mm.
It's not going to be the doctor we know today, which is a chief complaint doctor that will fix whatever complaint you have. And so I think that's going to be the fundamental mindset shift. And it's going to be hard for people because we're going to say the doctor in the pocket. And you're like, well, my doctor in the pocket only evaluates my chief complaint. And you're like, no, this doctor's going to help you stay healthy. It's going to see that you're at risk for, blood sugar issues and diabetes and heart related issues. So I think that's going to be, so anyway, I'll put 3 years. People can tell me where I'm wrong in 3 years from now.
No, I think the time horizon is reasonable. I would agree with you that I think you could say safely today we've already got a doctor in your pocket, and we've had one for years too, right? We called it Dr. Google before. Now we know and say it's Dr. AI. Um, so I think people are using it. I mentioned it before. I think some people unfortunately are forced to use it because they have no other access to any sort of healthcare or health professional. So, they ask it of, online, right? And see what they get.
Well,
Now
our
I
friend
do,
Amy Gleason with her
right,
daughter, she uses ChatGPT all the time as a chronic patient because she has so many doctors, so many conditions. She can't bug them all the time, but she
right.
can bug ChatGPT all the time.
Right. Now, I think to your point, I think people are smartly taking what it spits back with a little bit of grain of salt, right? You're not going to drink some poisonous liquid, hopefully, right? Like as a treatment, and you might want to verify by doing subsequent searches online to see if it's true. Like I think people are doing that. But I think for some common ailments, like you mentioned before, like a cold, a cough, you tweak your ankle, right? So you go, well, should I go to the ER or not? And then it's probably going to give you some advice over, try this, try icing it, or try doing this for a couple days, and then if it still doesn't go away, go to the doc, right? And so I think in those situations where there's low risk, like try some ice, try some heat, and that's not going to really, right? It's not going to make anything worse. But if you don't recover, then you might go to the ED, right? Like I think those types of things, to your point, we'll start trusting AI to tell us that kind of advice. And I think it actually will have an impact, a positive impact on the healthcare system. We'll stop clogging it up with people who don't really need to be there. The challenge is, what happens when something more severe and it presents like a sprained ankle, but it's something worse. And then you're arriving at the ED where it's a much more acute problem. That is something we're going to have to learn how to deal with in 3 to 5 years. But to your point, I think the type of medical situation we're going to trust with AI is not going to be what we typically go to a doctor or an ED for today. It's going to be something much more minor, much more treatable with over-the-counter medications or things like that, versus something where you really need to go see a specialist.
Yeah, and it's interesting to think about the evolution of how all this goes. I kind of look at it the way I treat my own healthcare. How many times have I reached out to my doctor friend and said, "Do I need to go see a doctor?" Whether it's my, like you said, my sprained ankle. I call my ortho friend and send him a text message. And I'm lucky, I work in healthcare, so I have a lot of those friends, right? I remember I sliced my toe, like from top to bottom. And anyway, long story. It was a TSA. It turns out TSA has some nice medical kits. But anyways, it was midnight. I messaged my doctor friend and I said, "Hey, do I need to go get stitches for this, or am I good?" And he gave me the feedback I needed. "John, you need to go get stitches. If you don't do it within 24 hours, then you can't do it." And he gave me that info. Well, not everyone has doctors like me, right? Like I'm pretty blessed in that way because of the work we do. Well, what does everyone else do? They're going to go to ChatGPT. So it's almost like it's a triage
Yeah.
in many ways. The same way I use many of my doctor friends is a triage to know, should I go and spend the effort that's required to go to the ED, to go to the quick care, whatever it might be. So I think that's where we'll see probably the initial evolution. But what happens is once you do that and they have all that info and you start trusting it, I don't know, it accelerates quickly and quicker than I think we think.
Yeah, no, I think so. And maybe one day, John, will have the home stitch, right? The home stitch thing you can just attach and it just does it for you.
Well,
That would
Elon
be,
said that. He said, "Hey, Optimus Prime, their robot that Grok and X and whatever it's called, XAI, is creating." He's like, he's going to be your doctor. And when you think about it, it's like Optimus Prime. What was that movie, Big Hero 6 or something,
yep,
right?
Big Hero
With the
6. Yep.
big, a
Yep.
marshmallow man guy that comes and scans you.
Yes.
Like Optimus Prime is pretty close to that. Doesn't have the scan feature yet, but it could get all of that data and it could use its devices to understand your health. It's fascinating. It's coming quick.
Yes. I would love if I could have I would love if I could have that.
You probably want the
The
Star Trek. What is that? The
Yeah, I want the holographic doc. Yes, I would love him. I'll even
and the
take the
one that
Star Wars.
scans you and tells you what's wrong. What was
Yeah,
that?
all of
The
those. Those are the consumer
tricorder.
techs that that's
Yeah.
the consumer tech I definitely want. No doubt about it. Being, as you know, being a sci-fi fan, I'll take any of those things. But yeah, Doctor in a Pocket. I'm sure we're gonna see that very, very soon. Hey, thanks to all of you who tuned into this episode of Healthcare IT Today. You can find more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and Health IT collaborator, John Lynn. Thanks for listening and have a great week.